Bismillah ar-Rahman ar-Rahim. In this episode, I will talk about clinical skills and their importance in daily clinical practice. Clinical skills, they are required for proper medical practice in our medical profession, in communicating and in getting in touch and in our daily life with other health professionals, with our patients, number one, with other doctors, with the staff, with the patients' families, with the society, with everything. The clinical skills, they are a wide spectrum, but I will try to focus on the important three common clinical skills which are important. First of all, the clinical skills, they can be classified based on the criteria of classification, or the criterion which is used in the classification. There are, I usually classify them into two categories: the general clinical skills and specific clinical skills. The general clinical skills are common clinical skills which any clinician should acquire them and use them and implement them in his clinical or in her clinical practice. The most important three common clinical skills are listening, to listen, number two, how to think and use what we call the logical reasoning and the clinical reasoning or diagnostic reasoning, or even in therapy, that's reasoning, the use of reasoning and logical reasoning in clinical practice in order to reach to a conclusion or a solution for your patient, or what we call the problem solving issue. So to reach to a solution or to a conclusion about your case, what is your probable diagnosis and how I will approach this case therapeutically, how I will start its treatment, his treatment or her treatment. This is thinking. Thinking is a skill. So this is number two, to think. Number three is to observe, because as we all know, observation is a mental process which is by itself a skill in clinical practice. Doctors might see, but only one might observe or is able to observe. So to see is different from being able to observe. So observation is a skill. Observation is a skill. If you have the ability to observe, you have an important clinical skill. So again, I will repeat that. Number one, to listen. Listening is a very important skill in general life and in the medical life, or in medical practice in particular. How to listen to people, how to listen to patients. So to learn to listen is a skill. And it's an important clinical skill, as I mentioned before. So these are the three important general skills which should be used in clinical practice, and I will start talking about them in general clinical skills knowledge. To listen, to think, and to observe. And then we have other clinical skills which are important in clinical practice. This will be in the specific clinical skills topic. And these specific clinical skills, they like the history-taking skills, how to interview the patient and how to take a proper history from the patient to understand his or her complaint and analyze the complaint and get the symptomatology and other things which the patient is suffering from. This is the history taking, which from by which or through which you can put your hand on the clinical symptoms of the case, which is part of the clinical picture. And then the second part, of course, which is important, is the physical examination or the bedside examination or the clinical examination through which you will detect the clinical signs and you might find signs of the disease. And then by both of them, the symptoms and signs, you will form the collectively what we call the clinical features or the clinical manifestations, which might help you to reach to what is the most probable diagnosis in this case, or to reach to a differential diagnosis, what is the diagnostic possibilities or the diagnostic differential in this case. And then you reach after that to the third step, which is how to choose investigations. Also to choose clinical investigations, including laboratory, pathology, radiology, endoscopy, etc., etc., etc. This step of choosing the proper investigations, which will help you to reach to the final diagnosis and or the definite diagnosis of the case, also has skills by itself. This is what we call the clinical investigations tailoring or decision skills. How to decide to write your investigations for the patient. This is also a skill by itself. So history taking is a skill. Has skills, physical examination and skills, investigation, clinical investigation, choice and arrangement and ordering is a skill itself. And then after that, you have other skills like I mentioned this, the diagnostic reasoning is another skill. If we widen our spectrum of clinical skills, there is also the skill of diagnostic reasoning. There is and I mentioned this in the issue of thinking. This is and thinking, they are almost more or less the same topic, the diagnostic reasoning, and then what we call the procedural perfection, how you carry out your clinical procedures like venous cut down, like putting a central vein, like a pleural tapping, like CSF sampling by lumbar puncture, tapping of the peritoneum. These are clinical procedures which need also that the clinician who will carry them should have skills of the procedure. This is what we call the procedural perfection skills. And then we come to the issue of teamwork skills and the issue of information processing, clinical information processing and interpretation, and problem solving. These are all issues in clinical practice. And then we come to another important skill, which is communication skill, the communication skill. And we all know that communication is part of management of your case in clinical practice, or what we call clinical management. As we all know, that management in general includes planning, organization, communication, coordination, and follow-up. So communication is part of general management, and also it is part of special management, like management of your patient, or what we call clinical management of the case, إدارة الحالة إكلينيكيا. So you should, part of this management is to communicate. And I will explain it also what's meant by communication including doctor-patient communication, the doctor-doctor communication, doctor-patient's family communication, doctor with other elements, paramedics with the pharmacist, with the nurse, with the society, with the community communication. This is very important skill in clinical practice, the communication skill, أو اللي بنسميها مهارات الاتصال. دي very important. والاتصال اللي هو communication is different from coordination اللي هو التنسيق. And then follow up, which is also a very important skill in clinical management. So communication. So all of these, which I mentioned, are important skills in clinical practice. What I will focus on in my next coming presentation will be the general clinical skills, which are listening, thinking, and observing. So by this I can end my this episode today, and tomorrow I will start to talk about these clinical skills which I mentioned in this talk today. I will talk about them in details. Thank you so much, and I wish for all of you a good day, and tomorrow let us meet again, and please don't go far. Thank you so much. Have a nice day.